Max, Governor Reynolds mentioned spring break as one of the reasons for that increase. Iowans who traveled are now back and in that 2-week waiting period. So while they wait to see if they have any symptoms, Iowa leaders say they are going to continue to take steps to protect the state against any possible increase.
It should be every Iowan's assumption that the virus is currently circulating in their community.
That recommendation comes as Iowa leaders announced 38 additional cases of the coronavirus in the state, totaling 336. 51 people are being treated in hospitals and 4 have died, the most recent being an older adult from Linn County.
Regardless of what age or risk group you're in, it is so important that we all do our part to protect our fellow Iowans.
Governor Reynolds says going forward, she will continue to take any steps necessary to ensure tools like ventilators are still accessible. Friday's order saw the suspension of non-essential and elective surgeries, including surgical abortions, to free up equipment. The governor says it's being done in an effort to avoid situations other states are reporting.
As we see the numbers continue to escalate in New York and some of the hot spots across the state, we want to make sure that we're able to take care of Iowans if we get to the point where we have more and more Iowans that require that service.
The Iowa Department of Public Health says they are now working on a contingency plan, focusing on if a need to ration resources for healthcare providers appears.
The goal, as Governor Reynolds has described, is to never have to implement that crisis standards of care plan by slowing the spread of the virus in our state.
Now, we also learned today that there are 840 test kits available at the state lab. Governor Reynolds says they will look to increase the number of tests they are able to do on a daily basis. Live at the State House, Kayla James, KCCI 8 News, Iowa's news leader.